question mainly to from radiologist or from radiologist stand point of view, Dr. Bashir Taouli. Are there any imaging features that would predict worse outcome? We have some other similar questions, and or it can be actually lumped together to Dr. Taouli to actually save time. Sometimes we see patients with normal chest X-ray, normal radiographic findings with very bad clinical condition, and vice versa. Can you please make a comment on that, and how would the imaging features predict the outcome?
Okay, I'll start with the last or first this question about predicting worse outcome. I think there is no clear data on this, like scientific data. That I showed you actually a couple of papers from China looking at quantitative, data. Or there's also some scoring system that has been also published. And obviously, the more extensive disease, the more likely the patient is going to need oxygen. But it's not necessarily a very, clear-cut relationship. But clearly, when you have worsening over time, I think that's really important. Having that temporal change in a few days, generally that's usually predictive of bad outcome. When you have like extensive disease appearing quickly, like I show you in that case, that's usually a sign of worse outcome. Now the other question about having patients with severe symptoms and negative chest CT, I think I'm going to let Keith answer that one, because I'm not so familiar. Usually all the patients we saw, we had a few that had no symptoms, but generally their disease was not extensive. It was just areas of glandular opacity. But I think once you have areas of consolidation that are significantly larger, generally these patients have some symptoms. So, but I'll let maybe Keith comment on that if you want.
Yeah. I mean, I don't have any evidence to disagree with that. I mean, my impression has been that there can certainly be patients without significant symptoms that do have X-ray findings. The point at which people become symptomatic is difficult to say. The one thing that has been, it's come up in some of our discussions and has been, I think, very notable with this disease is some patients do have, marked hypoxia and, imaging that looks bad that are not, they don't feel oxygen hungry in the way that a lot of other patients do. And there have been some explanations for that phenomenon that does seem somewhat unique, at least to some cases of moderate to severe COVID. So, in my, whatever experience I've had, when you have consolidation, probably would be associated with symptomatic disease.
Okay, thank you very much, both Keith and Bashir, for this informative answer.